Welcome back to Las Vegas Now. Southwest Medical is dedicated to keeping our community healthy this year especially. I spoke with the doctor to find out how.
Let's talk about how people can stay healthy this year, especially when they're being reluctant to their routine care because of COVID-19.
Really making sure you're staying up on your health care and not delaying health care is really, really important. And even if you're hesitant to come in, doctor's offices and all of our clinics are really setting up ways that remotely you can connect with your physician, your provider, and make sure that you're keeping your healthcare a priority.
Definitely. And I know that you guys are keeping it safe when people do want to come in. So tell us how you're doing that.
So now we're screening everybody who comes in, asking about signs or symptoms of infection, doing temperature checks, calling them even the night before to make sure that there are no health issues so they don't bring it in, expose our staff or expose our patients in there. We're limiting the amount of people that can come into the clinic so that we're able to keep appropriate social distancing in the clinics. We have everybody wearing their masks, covering both their mouth and nose to reduce the spread. And studies show that when everybody's wearing their masks appropriately, and if they're appropriate masks, that really does reduce the risk of spread within the community. And then also, now that the vaccine is coming out, we're making that available to all of our providers and all of our work staff so that they can be vaccinated both to protect themselves and protect the patients that are coming in.
Great. And also, you guys provide health screenings for people who are just trying to be preventative at this point, right?
Going into this new year, people should be knowing what their cholesterol is. They should be working with their doctor on their cardiovascular risks and how to reduce that. We always think about weight loss at the beginning of the year, but really knowing what your body mass index is, and is that putting your health at increased risk, and if it is, working with your doctor and his team to bring it down. Colorectal cancer screening is a huge one. It's an unfortunate, still high killer in the United States, and it's something that so many times we can prevent by doing the appropriate screening. And then, of course, women, they need, at appropriate ages, getting their mammograms routinely, doing cervical cancer screening, and even bone density screening for osteoporosis.
Such a great reminder. And of course, Medicare Advantage patients, they have a little extra.
They can come in and we'll be doing breathing tests. We do testing for peripheral vascular disease, neuropathy, bone density screening.
And if you, unfortunately, you know, some screenings do come in abnormal. So what should patients do when that happens?
So obviously, if screenings are abnormal, we need to get them in with the doctor, come up with a treatment plan. Now's not the time to delay a diagnosis.
We want to thank Southwest Medical for being our community pride partner. We'll be right back.